So what we want, of course, is this bone. If we transplant it, it can become part of our own jawbone, and eventually we can implant it here, in this piece of bone. However, in the year 2020, all our cases showed that this bone turned into a sheet. What is its function? Space maintenance. I hope it forms a space maintenance for us, and then in this gap I fill it with the best biological material, autogenous bone. The implant is within this bone fragment, so our purpose and method appear to be using autologous bone, but the approach is completely different and the logic is entirely different, resulting in different outcomes, of course. So this is what we are talking about. That is, our method determines whether it is predictable. Okay, so next, let's look again. Everyone will ask, I don't like BBA. Why do you do BBA? Is it to show off your skills or to show how skillful your hands are? Actually, just this afternoon, we saw our Dr. Xiaoyang skillfully drive a bone core, even able to drive 2 nails, which is very skillful. Including just now, Liang Qiu, oh no, not Liang Qiu, but Dr. Lan Chao. These tent pegs are placed very well. If you've tried it before, you'll know it's actually not easy to set them up. So what I want to say is, no, we have our own purpose. So why do we do BBA? Let me tell you the reason. First of all, when we talk about onlay technology, you take one piece and you can only place it on one side, either the ridge top or the buccal side. So whether it's a horizontal or vertical 3D defect, no, it doesn't work. So I can only open a second surgical area to retrieve it. However, I can cut it into many pieces. Look at this case of mine. I turned it into what we call a bony house. You can see this. A small bone house, right? I can perfectly piece it together. So am I creating a very perfect space? The best biological material is placed inside the space. So is it okay in the end? Its effect will definitely be very good. So this is what we say, it has a lot of space. Similarly, this case is also one of our bone blocks, which we divided into 4 pieces. So I can very well, as I just mentioned, bony house and box, treat this as a fence. In other words, I can be in the middle at the position of the gums. I can just support another piece of bone, which is to build a very solid foundation for the reconstruction of the gingival papilla in the future. So that is to say, I can very precisely perform our autogenous bone placement according to my needs. So this is similar to positioning, so we are very convenient. And similarly, I believe what attracts me, or what attracts many doctors present here, is the charm of BBA. What is it? Real bone autologous. When I did BBA for the first time, I was really fascinated by it. I had never seen such a beautiful bone 4 months later, because what I had seen before was all granular, scraped. After it's done, this part is loose, and the more you scrape, the more it becomes crooked, and you find it's all white. So when we see this bone, as I often joke, we doctors who work with bone mass like red, right? We hope for the reconstruction of red blood supply. What we need and hope for is that after we plant the cavity, a lot of blood emerges from it. What does that mean? This means we have very good bone quality. Otherwise, if it were white, it would be very dangerous. So this is what we want to say. Let's also watch a simple, straightforward video. We can see that before the surgery, it was relatively narrow, but through BBA, 4 months later, the sound is gone and it's a bit bigger. You can't hear it. Okay, let's take a look. BBA's contour is not its strong point, but it is. Real bone is the best, so after you watch it, you'll really agree with him. Of course, everyone might always talk about the differences between BBA and PTFE membranes and titanium mesh. When I'm discussing it now, we'll talk about this matter later. Similarly, in this case, we also performed an upper limit BBA. Let's take a look at this image. It's a very, very fascinating blood red, isn't it? Its bone quality is good. So sometimes when we increase bone mass, what are we pursuing? Is it osteogenesis from radiation, or is it the osteogenesis we see with our own eyes? This is something for everyone to think about on their own. I think this is a very profound topic to ponder, and I don't want to discuss it here. Let's look at one more thing, time. We talk about the PANTS principle. And what's one of them? Time. How many months do I open the box? In these cases, we have different defects. We have knife edge alveolar ridges. We have vertical defects. We have 3-dimensional defects. But all in all, we have our cases time. The average time is 4 months. Hey, is time important? Very important. Now, many doctors are in a bad medical environment. The big environment is not good, but I think more doctors are worried about delays, because if you do for a bone augmentation, you have to wait 8 months, 6 months, 8 months, or even 10 months. Aren't you worried about the titanium mesh being exposed in our 6th, third or fourth month? Could it be that we're worried about our tent pegs being exposed? Are we concerned that our PTFE coating is wearing off? These are all questions we need to think about. If I say, hey, I'll open the box for you in 3.5 months, 4 months, and plant a few implants, I guarantee it's very solid. So here I think time is a very important point. Finally, let me share with you another thing, which is a technical improvement of BBA compared to the previous onlay. Let's look at this picture. This picture is of a BBA technique we once did. However, unfortunately, in the second month, our autologous bone exposure occurred. If you see this situation, I believe many doctors who have done onlay and autologous bone will be very nervous. Why? Because there's a saying, die when exposed to light. When I expose the bone, what do we do when our bone is exposed? Many teachers tell us what to do. Grind it, polish it, grind the bone until it bleeds, and then let it crawl. Unfortunately, after 2 weeks, you see it hasn't crawled out yet. All right, then they tell you to keep grinding, let it crawl again. Okay, grind it again, right? Okay, grind it again, but later I found out that my piece was completely ground down. 2 months passed, and I might as well have removed it earlier. After 2 months, I could have done it. Now it's time to cut the losses. He removed it, and seeing this case, I was very nervous at the time. It was my first time. Later, we found out how it grew on top. Could it be a situation where a titanium mesh is exposed? Because this is a membrane. You can think of it as a membrane made of bone fragments. Hey, there's no problem. It's like a non-absorbable membrane being exposed. I can just remove it as long as it's after 2 months. Looking at our final results is actually very exciting. We see that there is no change in the whole body. Of course, there will be some exposure at the ridge top, and we say some soft tissue will grow in, but it does not affect the entire planting process at all. Therefore, we can achieve good results as well. For the slight loss of bone at the ridge top, we use it to make no problem at all. So I can still achieve very good repair results, right? This is also some new situations brought to us by BBA. Okay, let's summarize some of the advantages of our BBA, right? For example, I can cut it into 2 pieces, 3 pieces, or 4 pieces, which is one of its advantages. The second point is that we consider it a biological membrane, which you can regard as a non-absorbable membrane, right? And it has very good controllable measures. Additionally, there's its timing. We have a